result will be cystic fibrosis with related dyslipidemia.
دكتورة نادية، أنا هستسمعك دي عشان صوتك جاية. صوتك جاية فلازم تبقي موجودة لما تبقى صوتك موجودة. Yes, you should stay. Thank you very much. Congratulations, my dearest Maggie. I love to share, and I came for the sake of you because you know how much you are precious to me. And I wanted to deliver here. These photos are of our great professors who are building our lead professor, Dr. Samiha Samni. I owe to her very much. By the way, these photos come from the page of Professor Salah Nassar and from the page of this man who is sitting there, Mr. Mahmoud, Professor Samiha Sawalmir, Professor Zaina Radwan, and Professor Mona Al-Falaki, Professor Nadia Mustafa. I have a great memories with her since Professor Khalil Abdel Khalid conferences, my dear Professor Hela, and finally the head of the pulmonology unit, Professor Maggie Lees. I'm very proud to be with the pulmonology unit today in this cystic fibrosis day. Actually, forgive me for my voice. The outline of my presentation are 5 questions, and every question will be answered. And I will take a few minutes just to deliver a message. What is about dyslipidemia? Is there is a connection between dyslipidemia and cystic fibrosis? This is the first question. Are cystic fibrosis patients going to develop dyslipidemia? The second question, what is about pancreatitis in dyslipidemia? What is the correlation with dyslipidemia, pancreatitis, and cystic fibrosis? And as well, the relation of dyslipidemia with diabetes mellitus in cystic fibrosis patient. And can dyslipidemia in cystic fibrosis patient cause cardiovascular risk? This is the 12th question. Finally, how to manage cystic fibrosis patients with dyslipidemia. First question to be answered, what about dyslipidemia? What is lipids, cholesterol, and triglycerides? All we know it. We should know what type of diet should be prescribed in cystic fibrosis patients. We are giving them a high caloric diet. This is very important. They have fat malabsorption, so they are going to be prescribed high fat, high caloric diet. This is the advice that the nutrition clinic usually, or the nutritionist prescribe for cystic fibrosis. But we have the fact that we have pancreatic enzyme deficiency or problem in the pancreatic absorption, so we need to supplement the pancreatic enzymes as well. So we have high fat, high caloric, which is high fat and high carbohydrate diet, and this is a study about the cystic fibrosis associated with dyslipidemia. In the Journal of Cystic Fibrosis mentioned what are the type of dyslipidemia going. First, hypocholesterolemia. It is not hypercholesterolemia, and we are going to tell why. It is hypertriglyceridemia, and it is a low, high-density lipoproteins. A message for the juniors: high density make our health, our heart, our general condition high. The low density is the risky one of the cholesterol. So we have low, high density lipoprotein in these patients. Why do we have reduced cholesterol? Why? Because there is fat malabsorption. So there is usually no hypercholesterolemia in these patients. So this is the first point we should know. The second, why we have hypertriglyceridemia? Because there is a chronic inflammation. When we have chronic inflammation, whatever, in cystic fibrosis, in chronic illness, in chronic infections, in chronic diseases, we should know that hypertriglycerides may raise up. And by the way, do not neglect it, because we found hypertriglyceridemia reaching a very high levels, above 300, and the only risk factor is chronic inflammatory condition. So this is very important issue. The second question, what about, so we know that there is dyslipidemia and it's mainly related to hypertriglyceridemia. What about pancreatitis in these patients? This is the second question. Pancreatitis in cystic fibrosis, hypertriglyceridemia is a well-recognized etiology risk factor for developing chronic pancreatitis. I want to tell you something very interesting, that when you have a patient with chronic pancreatitis and you don't have anything else, please search for mutation for cystic fibrosis. And this is not me. It is, by the way, we believe in science when there is publication in peer-reviewed journals. It's not a general experience only or personal experience. Genetic determinants of the pancreatitis, they mentioned multiple selected mutations, and this one colored in blue is that there's cystic fibrosis gene mutation in patients with chronic pancreatitis. So usually you should search for this. And when this review article about the overview of the gastrointestinal disease in cystic fibrosis, they mentioned that we have pancreatic insufficiency. And please, when we have pancreatic insufficiency, there is fat malabsorption, except medium chain triglycerides. Why? Because they do not depend on the pancreatic enzymes or pancreatic juice. So don't treat pancreatic insufficiency cystic fibrosis by fats, because they will not absorb. It is, as mentioned, it is MCT. But those who have pancreatic sufficiency, and this is around 20% only of the patients, may develop chronic pancreatitis. So usually chronic pancreatitis comes with those who have pancreatic sufficiency. Okay, and this is mentioned that either the functional class to be severe pancreatic insufficiency or a mild mutation, and this will be a pancreatic sufficient patients. Third question, what is about the relation of dyslipidemia and diabetes mellitus in cystic fibrosis? Many mentioned that usually we know that those who have dyslipidemia, they may have as well diabetes mellitus. This could be found, but it is not usual to find in cystic fibrosis. If they are diabetic, they usually have dyslipidemia. There many articles mention that it could happen or could not happen. However, the presence of both diabetes and the presence of dyslipidemia are risk factor for cardiovascular disease in cystic fibrosis patients. And this is as well dyslipidemia, an article in the Journal of Cystic Fibrosis. They mentioned that dyslipidemia is not associated with the development of glucose intolerance or diabetes in cystic fibrosis. So it is not usual. If we have dyslipidemia, we will think about diabetes. No, it could or it couldn't. This is very important. The fourth question, the relation of dyslipidemia and cardiovascular disease. The relation of this and complications when we have high, low-density lipoproteins, when we have diabetes, when we have obesity in patients with cystic fibrosis, this is the result that a case, in this case, an acute ST elevation myocardial infarction in 2 young women with cystic fibrosis and cystic fibrosis-related disease, diabetes. So when we have these risk factors, in addition to the presence of cystic fibrosis, myocardial infarction, and non-cardiovascular complications are not linked. Finally, the fifth question, what is the management? The management of dyslipidemia in general, by the way, not here, we went to treat. This is very important. When we start the treatment, when we have hypercholesterolemia, and when we have hypertriglyceridemia, what is the level to treat? If we have LDL, low density lipoprotein, more than 130. This is alarming for us. The second, if we have hypertriglyceridemia more than 100, we should start. Start to buy drugs? No. It is very important to look for this. We have classified, I will not, don't bother yourself, by the way, this is from up to date 2025, high risk or moderate risk or at risk. All these, whether high risk, the only high risk we are going to be treated with the statins. But all of them, we should start by two things: nutrition and be active. This is the most change the lifestyle condition. This is very important. Back again, so nutrition is very important. And I would like just to mention, this is a cornerstone in therapy of dyslipidemia and in cystic fibrosis. Of course, I would love to present this, which has been published in the Clinical Nutrition of European Society of Enteroparenteral Nutrition, and was 9 years ago, by the way. And this would mean to Dina Hussam, I don't know, yes, Dina is there. And my Mahdi, she was assistant lecturer with Dr. Mona Fathi and Dr. Mona Al-Falaki, and published about the nutritional rehabilitation of cystic fibrosis. By the way, the journal was astonished, thank you, the pulmonology, that we have 50 patients with cystic fibrosis who have been followed up for nutritional rehabilitation, and this was an aim for this, and it included, as I mentioned, 50 patients with cystic fibrosis. Everything has been done in this algorithm. We did nutritional assessment from history, physical examination, subjective global assessment, anthropometric, signs of vitamin deficiency, and laboratory assessment. And we go through nutritional management, dividing it in calculating the caloric requirements, in giving the vitamin needed, added A, D, E, K, and the mineral supplementation when there is deficiency, water and salt supplementation, and the pancreatic enzyme replacement. All these, the algorithm which we go through, and what happens significantly when we do this with the follow-up, when you put an algorithm, when you put a plan, there is significant improvement in the weight. By the way, the height was not significant because there is a short duration. It was for 3 to 4 months only. It's not for long, because for a long, maybe after 1 year, we will find an important increment in the height as well. So this is, and the weight for height, the BMI is markedly improved after this. Even the serum albumin, serum pre-albumin, all of them are improved significantly. Others are not. The liver functions and everything is not improved, but this is very important, albumin and clean albumin. And we concluded that the nutritional assessment, nutritional management is very important in cases with cystic fibrosis, and we recommend that there should be a simple algorithm for nutritional assessment and management, and this is as well done, and I think they are doing very great in the nutrition clinic. For dyslipidemia, what is the relation? I mentioned it is nutrition. We need to answer this question among our Egyptian children. What is the prevalence of dyslipidemia among Egyptian patients with cystic fibrosis? We need to know. And we don't know what are the risk factors. Is there associated obesity, type 2 diabetes? And what is the role? What are the effects of nutritional management and lifestyle changes on the lipid profile in these patients? Thank you.
Thank you, Dr. Nehal, for such a pleasant experience with the unpleasant dyslipidemia. And we just, with Dr. Mekki, we created a team that will be responsible for ongoing care of the nutrition rehab of cystic fibrosis patients. So we'd love to gain your experience on this, maybe guiding the team on how to go forward with the work you already started and with a lot of work that you started. Professor Nehal is one of the most enthusiastic and energetic professors we have. Thank you. Gives me great honor to introduce Professor Muhammad Saeed. He will be talking to advancements and outcomes in lung transplantation for cystic fibrosis patients. And it's always a very big challenge to have to talk to the pediatricians and get them all interested in the doctor. Good luck. Looking forward.